Friends and family, welcome to another live broadcast brought to you by Premier's Turning Point, which your host, Bishop Dr. Uton Lang, and co-host, Overseer Franklin Williamson. We pray and hope that something that is being said today will bless your soul and spirit. Please take a quick moment to like and share this broadcast with your friends and family. Thank you again for joining us. Let's go into our live program.
Blessings, blessings, one and all. This is a pleasure being back with you live today. I know last week we kind of filled in, but we are so happy. We're so happy to be back with you today. And, it's really a lot of things going on in the world, and it's in America and all over the place. And especially right now, I know we want to spend some time today kind of talking a little bit about the COVID-19 vaccine that should be coming available. I know there's all kinds of feelings about that, some good, some bad, some indifferent, but we hope to dispel all your fears and give you the facts and the truth today so that you can make a decision. This is definitely a turning point in all of our lives, when we see what is going on. So again, I'm Bishop Dr. Lang, and it's so good to be with you. We have our co-host, and he's going to just talk to you a little bit now, and then we'll get right into the program. So, Pastor, go ahead.
All right. Again, we want to thank you all for joining us. As the Bishop said, we took time off, just 1 week, but here we are today. We are dealing with current events, and even though we are actively in the ministry, we also have a very holistic ministry where we look at the total man. And we have just heard from our CDC that Operation Warp Speed, which was led by our President Donald Trump, that the vaccines will be available within at least the next 30 days. And there are many truths and myths about this vaccine. And I hope that you will get online, get on Facebook, and send in your questions. We have a medical doctor, Bishop Dr. Lang. I will be the one posing the question. I will be somewhat antagonistic in my approach, and I'll also let you know my personal views on the vaccine. But as you can see right now, the death toll has surpassed 250,000 here just alone in the United States. And we have learned that our greatest line of defense is those 4 steps or those 4 protocols that our CDC has required of us. 1, wear your mask. And when I say wear your mask, I mean wear your mask properly, not half mask, not the chin, but ensure that you're covering the nose and the mouth. Most masks has a little piece of bone or a metal or a thick material that allows you to curve it properly above the nostrils. So make sure you're masking up properly. Also, social distance, 6 feet. The reason for that, the droplets can travel based upon the studies 6 feet, and anything closer than that, you're at a higher risk of someone who is infected with this disease. So mask up, social distance. We're also told to wash our hands. Wash your hands. Try to not have your hands in your face, especially when you go outside, and ensure that you wash your hands 20 seconds. What I told the church, if you recite the Lord's Prayer, that's 23 seconds. So you'll be praying as often as you wash your hands. And besides washing your hands, if you don't have soap and running water, you're on the run, you're in and out the car, get yourself hand sanitizer. CDC recommend 60%. You will find that there's 75, 80, 90%. Just make sure that you allow the solution to dry on your hands. I've seen folks spray their hands, then grab a towel and dry their hands. No, let your hands air dry. So if we do these protocols, we will help to retard, we'll help to slow the spread. But today's discussion is primarily on the COVID-19 vaccine. And we want to look at how many different types are there. What's the impact does it have on male versus female? What impact it has on a child versus an adult? And who should get this vaccine? And how should we roll this vaccine out? We also learned that it's not one shot. It's 2 phases. And a lot of folks have truths and myths about, if I take this COVID-19 vaccine, will I contract COVID? So I'm going to open it up, a discussion with our doctor, Dr. Leng. So Dr. Leng, just give us some update on the latest on this COVID-19. I have quite a bit of questions. I did poll a few folks within my church, and I have some questions here. So go ahead.
So what I'm going to do, just give you a general, overview of where we are, and then let you, kind of do the specific, because I really want to hear more so what the people want to hear. What the questions they have. So it's not so much more. I have a lot prepared, but I'd rather go with the questions. And of course, anybody who's joining us and you have a question, please pose it in the chat, right? And so that we can also answer those as well. So just so everybody is just up to speed right now, you need to understand a couple of things is that this vaccine is using kind of a new approach, is using something called the messenger RNA. And the key points you need to understand about this, our mRNA, the short for messenger RNA is mRNA. They're a new type of vaccine to protect against various infectious diseases. Now, to trigger an immune response, many vaccines put a weakened or inactivated germ into your bodies. But this is not so with most of the vaccines, and definitely not so with the mRNA vaccine. So what they do is they teach our cells to make a protein or even a piece of protein that triggers an immune response inside your body, and that immune response produces then antibodies, and that is what then protects you. So basically, it's a protein. This mRNA protein triggers your cells to produce more of these proteins that's gonna then give you a response that will then make you technically immune, because you're gonna now have antibodies. So the mRNA gives instructions for our cells to make a harmless piece of what is called a spike protein. And the spike protein is found on the surface of the virus that causes the COVID-19. So then your body then produces things that will attach to those and then cause this. So the mRNA vaccines are given in the upper arm muscle. And once they're inside the muscle cells, the cells use them to make this protein. This is the way I'm just kind of breaking it down a little bit for you. All right. And the cells then use them to make the protein, and that is going to then affect. After the protein is made, the cell break down the instruction and gets rid of them. So basically. So next, the cell displays the protein piece on its surface, and our immune system recognizes that the protein doesn't belong there and begin building an immune response and making antibodies, like what happens in the natural infection if you get it naturally. So at the end of the process, your bodies have learned how to protect against the future infection. And the benefit of the mRNA vaccines, like all vaccines, is those vaccinated gain this protection without ever having to risk the serious consequences of getting sick from the COVID-19 virus. Now, don't get me wrong, sometimes people do have reactions because it's a foreign material. So you may develop a little bit of fever, a local inflammation at the site, and maybe even a little fatigue, but usually that is going to pass in a much shorter period of time. So that's a general quick overview of kind of mRNA vaccines, and kind of how they work. And of course, don't forget the vaccines are going to go through vigorous safety protocols, and they're going to be monitored and followed, and then just really followed up closely to see if there's any reactions. Of course, there may be some mild reaction, but no serious reactions have been found so far. All right, Pastor, we go back to you for more specific questions, or if anything I just said that you'd like to be clarified. Yeah, I think you're muted, Pastor. Go ahead.
We know that there are three types of vaccine. You mentioned mRNA, and then I
Yes.
see there's a protein subunit, and there's a vector. Are
Mm-hmm.
these three types, and do we get all three? How do we know
So,
which one
so,
to take?
so far, the main ones that are out, all right, the
Yes.
main ones that are out right now are really all really kind of similar. Most of the ones that are out that we're going to be getting here are mRNA viruses. They are working, not approved yet on other ones that are, working in a different little way. So right now, what is coming out, first of all, the Pfizer one, it may be coming out first, and the Moderna one will be coming out next. And those are both working off of the same system.
Okay.
And remember, all of them triggers the body to make that protein that you're talking about, and
Right.
and then they go from there. There's another way, of course. There's also DNA associated, DNA viruses, but the same kind of thing that works. It's quite similar. It's just that it uses the DNA versus the RNA.
All right. So, what makes this vaccine so different from other vaccines? Because what we have learned is that this warp speed,
Mm-hmm.
how is it possible? Is it really science? And most times you have to inject someone with the vaccine and monitor and trace that person over time. I don't think we've got the time to monitor and trace any human being.
Well,
So,
yeah, yes, and no. They actually remember now. Before this is, vaccines go through various phases, right? They
yeah,
have had animal trials, and then they have actually given humans, quite a few humans, actually thousands, have received this vaccine as part of the trials. Before they can bring it to fruition. So that has been ongoing. I mean, and they had many people volunteered to get this virus. And remember that, and I know the one trial they have as much as 30,000 people. One had a little bit more. So before a vaccine can be approved, it has to go through that. Phase 3 is that human trial where the human, and there's actually people who have gotten both shots, so one and then a month later, and have been followed so far. Yes, they have not been followed for years, but they've been followed for months. All right. So the thing is, and so far, they're going. That's why they're looking to give it this approval. They're going to look at all that data. Look at everybody who has received it, how they've reacted, and all of that. Remember in the trials and why they can make some thought about, hey, it's so much effective. They give apparently half of the people get the vaccine and half does not. Then they
right.
follow them, and they see how they react. And so far, there's been a lot more people sick in the group that did not receive the vaccine. That's how they come up with these percentages. And also, especially the Moderna one of the key things that they also found that those people who got the vaccine, even if they got the infection, they had a very mild form, and saw no serious complications in that group of people versus those who got the placebo who did not receive, they had some serious complications.
Yeah, but many of our folks are very skeptical. One, as you spoke about the sample size,
Mm-hmm.
do we have folks who look like us, meaning the demographic, that they can trust the results? Got to make sure that you're getting someone who is color, brown, right, certain weight, certain height, have certain preconditions, making sure the sample size reflect our population. And
Yeah, they did. Mm-hmm.
from what I'm
That's
reading,
definitely one of the issues. Yeah. Mm-hmm.
yeah, go ahead.
That's definitely one of the issues. And they did have, all across all groups. Next program, I will give you more specific, actually, data. So next week we'll give you a little bit more statistics. Today I wanted to kind of do the general stuff, but there is definitely data. They did not have as many black and brown people participating for the same reason. People are skeptical, but they did have an adequate amount when you look at the overall data. So we'll give you more specific where that's concerned. However, I think the key point to remember and think about here is, for things to be approved. Remember, there's a whole FDA approval system. So it has to go through. If the vaccine, if it had not gone through all the phases, no, we're not living in Russia, okay? The
Mhm.
Russians, their vaccine, they skipped the phase 3 trials and started using it. All right, but that does not happen in the US, and that's why some people that how come Britain have it before us? Why are we worried? We're the same people who are saying we're skeptical. Let's go through the process, and so they're following the process, and they're going through all this, they're checking all crossing the I's, dotting the I's, crossing the T's, and going step by step. It's been faster because I think there's been a concerted effort. They've been working, tirelessly, but they still have put it through the same procedure, even if those that took longer.
So when they say efficacious, 95%, 96%, now that
hmm
other 4% and 5%, is it
Yeah.
fatality? Or, I mean, what is the other percent that
No,
they're
no,
saying,
it's not fatalities, but it's, basically then, for example, say you give 100 people the vaccine,
right?
all right, just to give you 95, basically had not much react and were exposed to the disease, did not come down with the disease or didn't have anything major. Then there's about 5 out of then who probably got a moderate form of disease despite the vaccine.
So pretty much then the vaccine for those other 5 wasn't effective.
Who even are not as effective as with the others. Yes.
With the other. All right.
Yeah.
Fact or myth, the COVID-19 vaccine will not give you COVID-19.
That's a fact.
That's a fact?
That's a fact. And the reason it's a fact, remember, that goes back. That's why I started off with the initial segment. You're
Yes.
not getting the live virus. You're not getting an attenuated virus, which is a weakened virus. You're getting basically an RNA, genetically engineered protein that is going to simulate your body to react as if the virus is in your body. So there's no way you can get the COVID-19 from the vaccine.
So,
I'm not saying you may not get a reaction,
okay.
because of course, if you get a reaction actually tells you that your immune system is working. Remember, I think I explained this on a couple of programs before.
Yeah.
If you are exposed to a foreign body and your body just sees and just going, hey, this is normal, and doesn't react, something is wrong with your immune system. But if it sees a foreign body and it said, oh my God, this is something foreign, I need to attack it and chew it up. How am I going to attack it? Raise my body temperature. I'm going to cause all kinds of things to happen. So you may get a reaction, but it's not the disease.
All right. Second factor or myth. COVID-19 vaccine will not cause you to test positive for the COVID-19 test.
That is also a fact. It's not going to cause you to test positive, because remember now, the test is a test looking for the virus, more specifically the virus, that specific virus. So it's not going to show up positive for that.
All right. Last one, fact or myth. People who have gotten sick from COVID-19 may still benefit from getting the vaccine.
And they may, however, they're not going to be the ones to get it, because those people should have an antibody test done. And if they have antibodies, then they should not be getting the vaccine. So they're not going to be giving the vaccine to known positive COVID-19, unless, of course, we're going to probably be following the antibodies over time. And now, if your antibodies wane and then it goes away, because remember, we don't know that yet, how long the natural antibody is going to last. So say in a year, you're checking you don't have the antibody, then you would then benefit from getting the vaccine.
All right. I'm glad you mentioned antibodies, because that's the next big question. What is the difference with the COVID-19 test and the antibodies test? What is the difference?
Okay, here's the difference.
Yes.
The COVID-19 test is really testing to see if you have active virus in your system. You can think about it that way. So they actually swab tests from the nose is really a piece of what they call a polymerase chain reaction, where you actually look for the actual viral particles by DNA. They look for that. So if they identify that, yes, you have COVID-19. Now antibodies, remember, as I was saying, the same, if you get the virus, all right, then your body fights it off, you recover. you should have antibodies. If you get the vaccine, right, then the same thing your body, because we're given this fake protein, think of it that way, this protein that's going to stimulate, your body is going to still react, and you're going to have antibodies. So now you have antibodies are formed after the bodies and learn that this something is foreign, they fought it off, and so basically it develops a defense system. So anytime your body sees that particular item, virus, again, it's going to then let loose these antibodies that is going to attack it, and then that's why you should not get that full-blown outright infection. Now, there's actually phases in antibodies. You have a early antibody, and that one will show up when you're just in the process of fighting, and those are called the IgM antibodies, all right? So you can have COVID-19, because when we do the blood test, we check for the IgM and the IgG. The IgM is that says you probably have a current infection because your body is just in that motion. So then the IgM, a way to think of it is it flips into become a developed defense system. Now it becomes an IgG. All right, and that will say now. So if I test your blood, if you're in the middle of an infection, you get a blood test, your IgM may be positive, but the IgG may be negative. Give it about a couple weeks. Your IgM most likely, because now you're fine, is going to now go negative, but your IgG should now become positive. And the IgG is the one that's saying you have that your defense system is now ready to face any further infection that it may have.
All right. Now,
so that's so the antibodies. So that's what I was saying before. If you have just have the COVID positive, you really don't need a vaccine. What you need is a test to see if you have antibodies.
Okay. Someone just sent in a text there. Would you recommend taking the vaccine? And before you answer that, there are negative and positive between male and female. Are you aware of any adverse effect?
There is some anecdotal things, but I'm going to table that for next week, where I'm going to give you full statistics. We'll give you more detailed statistics about that. So far, just so you know, though, I know you had said something about children. They did not. So far, we're not giving children the vaccine because they have not studied that. They haven't done They're now working on the testing for children. So that was not going to come right off. That probably in a few months, but they're now doing the trials, for the children. So they did start with the adults where that's concerned. But for the male and female, I'm going to give you statistics on that, next week.
All right. The question came in, would you recommend taking the vaccine?
All right. I'm going to give just as a very general answer. I actually recommend all vaccines. And the reasoning just goes back to, once they've been studied and they've gone through the regular testing, that it's safe, all right, and that it's, it's been through the rigor, because what is the purpose of vaccine? Remember now, I use an example. Most of the younger generation does not know what measles is. Yes, all right? Yeah. My and your generation still had measles. All right? Yeah. I mean, I definitely had measles because, and why is it that we don't have measles mums and rubella just running around the place randomly? And that's because of vaccines. All right. Yeah. And actually, that vaccine is actually an attenuated live vaccine. So those are actually, the MMR and the varicella, those are actually attenuated live vaccines. That's why those are the only ones we have to keep in a certain state. And but they basically it's like a kill the vaccine, and then they put that in their system. But even with that, we have eradicated measles, mumps, and rubella from most of the world. And now, remember, we had a resurgence the other day. If everybody remember, there was some cases, and then in various countries. And why is it? Because we have a lot of anti-vaxxers who, for whatever reason, and I'm not hitting them, that's their prerogative, but for whatever reason, whether they claim it a religious reason, whether they claim it's just a reason, and that and there's a lot of controversy over certain points, which I'm going to bring up one of them in a minute, so that people for various reasons then are just against, and therefore we started to see a resurgence of certain diseases that we had eradicated. Polio, All right, not even our generation knows much about polio, right? I don't think you know anybody your generation that has polio.
Yeah.
But basically, how did they get rid of polio? Vaccinations. So you see this. So from that standpoint, and maybe because it's my medical background, but from that standpoint, I am for vaccines. And again, there's a lot of other anecdotal things that vaccine does this to you, does that to you. I've been doing this now for almost 30 years, and of all my patients that have even gotten the MMR, I have two children when my practice was at that height. I had about two children who were autistic, and I did not relate them to those vaccines, even though people were telling you. And I think if this was a case in point, I think I should have seen a lot more for the amount of shots that has been given in my practice. So both from an anecdotal point and also from a scientific point of view, vaccines I think are a good thing. And again, right, I go back to the place where the Lord is the one who gave us the knowledge. Without the guidance of the Lord, we would not have had the knowledge. I don't care how great a doctor is. If the Lord isn't intervening and giving us, open up our minds and our understanding, then we're not going to have all these cures or these things that are going to be helpful. So therefore, I rest my case.
All right. Good. Now, as you mentioned, the vaccine, it's not ready for our children. And as you know, the schools are opened up, and the uptick is pretty much amongst the staff, amongst the teachers and the staff. And as a result, the parents are very fearful in sending their kids, let you the word, in harm's way. Do you see the government making a push to have the vaccine being mandatory, especially those who are frontline workers or nurses or doctors or technicians, EMS technicians, and so like? Do you see that coming where it's going to be compulsory? It's going to be required?
I see it. I don't think the government is going to make a general mandate that it's compulsory. However, I think in certain areas, like in the health field, they're going to say you need it to come to work. And, if you don't have it, you got to make the choice. You don't have to have it, but then you're going to have to go work somewhere else. I think some of that happens now even with the flu vaccine. You know that. I don't know if you know that. The flu vaccine is not mandatory, but most of the healthcare facilities will not let you come to work unless you have it. And if you don't, or they come up with a plan where you have to wear a mask. Even before now. I mean, if you want the hospital flu season, you see a lot of people in masks because they opted not to get the vaccine. So I think they'll have to come up with something like that. If you're not vaccinated, you're not negative, you're then probably still going to have to wear a hazmat suit or a mask if you're around people. But I don't think, the way this country is run, we're not going to see that. I mean, some people would probably want to do that, but I don't think that's the way we run this country. And I don't think you're going to see you must do this or else. But you may see you must do this or you can't be here, for the various, occupation and various jobs, because that actually is already infecting certain areas, So I think it's more from that standpoint. But I think what you're going to hear coming from the administration, you already hear it already, is a push to try to get everybody to think about the next person. Think about, what your actions is going to cost the next person, even in your household. What is your action? I mean, I go, out at least most days of the week. So, I mean, I have to think about it. I could be sick crazy and say, I'm not going to wear a mask. I am not going to do what I'm supposed to do. But then how would that affect the rest of the people in my household? So I know how would you respect the people you're interacting with? So I think it comes back down to a personal responsibility and the personal integrity for doing what is right and what is helpful, not just for you, but for everybody else.
Right. Okay. Okay. So you believe then to eliminate the need for the mask, the vaccination is the way to go?
Yeah, I think if the mask right now is our best line and I don't want to downplay masks because I think remember now the vaccines first is just going to be the frontline workers. And of course, they have to get 2 shots. Okay. All
Yeah.
right. So it's not like we're going to snap our fingers, it's going to happen. And then, of course, your body have to develop the antibodies, right? So we're talking a person getting a shot, the next one, I think, in 4 weeks or so. And so it's got upon about 2, 3 months, even before the first set of people could even be thinking about not wearing masks. And you'd have to have your antibodies checked to make sure that you did make antibodies. So I think we're masked for the next foreseeable future. And I
Right.
think that's the way we should all be thinking. And this is a way that we're going to help, the situation. Look at Newark. Newark actually took a 2 week of kind of shutting everything down, and their cases dropped from, I think it dropped from 17 to 13%. Yeah,
Right.
and that's all that's from a 2 week hiatus. So you see,
Right.
masks. I mean, I think all these things we're seeing, mask is quite helpful in preventing the spread. And
Right.
this is one of the reasons why, as this with us, we preach in a mask, we sing in a mask, we do everything in a mask, because of the thought process of as you mentioned before, and actually you were saying 6 feet. They're thinking the smaller particles goes as much as 13 feet.
Yes.
The bigger ones are probably going to die and drop to the ground before 6 feet, but
Right.
those smaller ones are circulating, and so that's why I think a mask is important. And even though the vaccine is coming, because remember the vaccine is coming, I think after the 10th, I'm most likely going to approve it. So in about a week, so after that, they're going to start the first group. Remember, they're still manufacturing, trying to, and by the time they get to the population, and also based on what you said earlier, the fact that a lot of people are hesitant. Because remember
Yeah.
now, for the vaccine to be totally effective herd-wise, we need a 70% vaccination rate.
Yeah.
All right, and right now, from the studies and what they're saying, there's about 52% that are saying they're going to be willing to take it. So even so, there's going to be a lot of people running around if they don't take the vaccine that are still then going to be potentially infective, and this is why the masks are also going to still be important.
Well, part of the reason why folks are very apprehensive and doubtful is we learned that that the virus is novel. It's very new. We learned that the DNA composition, there is no pattern. But now we have learned that we found a vaccine so rapidly that can be used at a 95% efficacy.
Well, one of the things you have to understand, though, is they've been working on RNA systems. It's just that now that this came along, they went foot long into it. So that's part of the reason why they were able to come up with this. So it's like there's some of this some of this research have been in the works,
Especially,
because they've been studying, especially since Ebola. So a lot of
yes.
this stuff has been in the works. So it seemed like, damn, we got it, but not really. They've been working kind of on it, but they went a warp speed, if you take that term, in terms of making sure that, dotting their I's, crossing their T's, and then to move it to the next stage, and they got to the third stage. So that's why, when people were saying it's going to come out in 2 weeks, 3 weeks, no. And everybody, remember at the beginning, Dr. Farger said it's going to be about a year, and we're right about a year, okay, for this to, to happen.
Right. All right. Have we learned more now? Because when this COVID-19 came out was back in March.
Mhm.
And what have we learned differently now? We are pretty much 7-8 months into it that we have not known then.
Well, I think we've learned quite a few things.
Yes.
We've learned quite a few things. We've learned that, all right, there's people react in different ways, and people may have different symptoms, and that just is specific to a person. I had one person this week tested that had no symptoms, and I can't find the source of their exposure, but they're positive. And actually the PCR test, the nasal swab, to me, again, just so people know, to me so far, that's one of the more accurate ones. All right.
Yeah.
Versus the rapid and the other one. So if you get a positive on that one, you can say it's a positive. So, And so then what makes one person a little bit more susceptible? Some of that we still don't know, but we do understand that if you're exposed, that virus is going to do its thing. Your body may, develop antibodies and fight it off, and you don't have that much symptoms versus you can have a myriad of symptoms. And that's the other thing we have learned. The first time I saw somebody with abdominal pain, I'm like, oh, this is not COVID. But now, if I was this time, I would say, yes, you have the COVID because it's just such a gamut of symptoms. At first we didn't realize that taste, the loss of taste and smell was an issue. I mean, fever, and actually a lot of these people have these things without a fever. So that's the other thing. I know at first we were banking on this fever, and yes, it's still important to check it because if a person has a fever, then you have to be more. But so we have learned that it can present in so myriad of ways. We've learned that you can be asymptomatic and still spread
Yes.
the virus. Okay, we have learned that children can also spread the virus. They may be a little bit more resilient, and again, we're not sure what's in their immune system that they tend not to get the worst part of the disease, even though some children have died. So it's not across the board. So, and then we have learned that one of the ways to prevent it is really to wear a mask. As a matter of fact, somebody was asking about a cloth mask, whether that is effective in protecting. I mean, it's effective, to an extent because it's blocking your secretions and things from going forth. Of course, if you should be cleaning that, washing that on a regular. So it's actually effective in stopping that spread from a cough, from a sneeze, from speaking, from the being spread about. I mean, of course, some of the other ones are more effective, but it is effective in doing the baseline prevention. So we have learned a whole lot. We have learned, also that, if you're more have a comorbidity or a pre-existing medical illness, which make your immune system not as bad, then you may be able to be prone to get a worse case. So, of course, for those people, a lot of the places have approved for them to be out of work, or work from home. So, all of that stuff we have learned, and when you put it together, that we didn't know in the beginning. But the bottom line is, each one of us, I think, should be responsible for protecting ourselves and then protecting others. Because in protecting yourself, you do that to others. If somebody in your household is positive, and you have to quarantine them within your household. We have learned that, and that's why when you talk about the school, just to the back on to that point, I think the key point with the school is we know the children are a little bit more resilient and all that. So you're right; they have to be doing frequent testing to the ancillary health, the teachers and all the others, so that actually people are coming there that are not positive. Then you have to do the distancing with the mask. Then my big pet peeve, as you know, is the ventilation system. Have to be solid and good so that you're cleaning the air. If you have an older building, yes, the days are a little cool, but you may have to open up some windows. You have to circulate the air, get rid of the old, bring in the new. But the newer ventilation systems are able to take care of that. You have to have the right filters. So I think that's why I think school is probably relatively safe if you're testing and you're tracking and you're doing all the right things. And see, because remember now, as much as the parents that are scared, yes, those parents who you better open school, they're like, they're protesting to open schools. So we have two things that we're going against here. So where's the happy medium? The happy medium is you probably can open schools, because the one point they were making is that within the school system, it look as if the rate was much lower than actually in the general population. So I think testing, doing the follow up, and is again then make it be able to potentially open up the schools.
So question. I get my test quite often. What's the frequency should one be tested? Now, let's see the results. You did the COVID test, let's say Wednesday, 3 days. Result came back on Saturday. Now, how long before you should get another test?
Well, I think basically, if you think about the whole issue of the incubation period and all that, which is about 5 to 7 days. So I said probably you probably have to test people every 5 to 7 days. It would be a frequency. So maybe once a week would be a relatively good frequency in testing. Because you have to think about, say that you test a person today, all right, if they were exposed a day or two ago, they may not have showed anything yet. But then if you test them within 7 days, they should have, been showing or, growing that virus in their system if they're infected. The key point of that, I think, though, is if you're still watching for symptoms, you're still checking on symptoms. Anybody symptomatic, I mean, it should be tested when the minute they become symptomatic. Even if I test you yesterday, but now this is today and you're symptomatic, either I'm going to quarantine you, all right, and then get you out of the system, or I have to test, all right, and go forward. So I think those are the key things. I mean, I know like in the nursing homes, I mean, some of them are testing people every day because of the high frequency that we see it in those kind of settings. So, and if you're in a hospital setting, I think they're testing every day. Yes, a lot of them are using more the rapid tests, but at least if those come back positive, they're probably positive as well. The only thing is sometimes those can be negative and be falsely negative. So symptoms, daily check-in, daily follow-up, for those people in those higher risk areas. And then for the regular population, I mean, if you think you're exposed, you got to test. If you say that's negative, probably in about a week later or so, you should be testing. One of the things I'm also going to look up for next week, because it's a little controversy. Supposedly, all of these tests should be done free, but a lot of people are telling me they're getting charged at certain of these areas that they go. And so I think you're going to look up in New York and see what you find. But I thought the government's supposed to be covering these. One of my labs that I work with tells me it's free. No matter the person doesn't have insurance, I can still send them, and as long as they're legal, then it should be free. So I want everybody to start arguing. If somebody's telling you have to pay for this test, you need to ask them why, and then we'll try to get to the bottom of that as well.
Well, in New York City, whether you are immigrant, whether you're documented or not, you can get the test for free, and that is the COVID test. However, the antibody test is not free.
I understand that.
You pay for with your insurance. So, that's an elective, right, as opposed to the COVID-19 test.
The antibody. Yeah, you're right about that. So, but that initial, that nasal, that's a swab, or if they're doing oral, those I think should be free of charge. So if anybody can't get a test because somebody's telling you have to pay, I know in New Jersey you just have to go, you just have to text 211, I think, and you can get all the information. And we'll also have those numbers for everybody next week. And then a lot of places now are starting back up to have these testing centers. I know in New Jersey. To where you can just have to make an appointment and you can go there to get a test. Mm-hmm.
Now, Dr. Lang, this may be an early question, but as the flu, there's an annual vaccination. Is that be the same for COVID-19, or it's going to be like the MMR? You get one
good
shot.
question. Good question. We don't know yet. We don't have enough time yet. So what they're going to be doing then, everybody who gets the shot, I'm thinking whether in 6 months, they're going to be testing to see if you did make the antibodies and did they remain. Remember, even the people who have had the infection, we have to see if these antibodies wax or wane. Some antibodies stay on for a long term. For example, with your tetanus, those wane over about 10 years. That's why you're supposed to get a tetanus shot every 10 years. And actually, we can ask everybody who's on today, did everybody on have a tetanus shot in the last 10 years? And remember, the tetanus is a thing that caused by botulism tetani, which causes lockjaw. If you are exposed to a dirty wound, and get an infection, you can get that. Get the accidental cut. So that one, from all the studies they have done, we realize that those wax and wane after about 10 years. So that's why you need to get one. With the flu, that it doesn't seem, and the flu is a couple of reasons why you have to get a different one. There's so many strains of the flu, so that you may be immune to one but not the other. So they do a statistical program to figure out which strain is going to be prevalent the next year.
Okay.
So that's why, and so then they make the vaccine to cover that, mainly that strain, so that's why you need one every year. So we don't know that what COVID is going to do as yet. So that's something that we should probably know within a year. What are we going to have to have an annual, vaccine versus, you got it and you're done for life or for 10 years or however many years.
And you mentioned about the side effects. It's pretty much your immune
Yes.
system reacting to the foreign
Mhm.
protein, right?
Yes. And they
that,
definitely say, yeah,
that's a positive.
yeah, and that's common. And they definitely say you're going to have some side soreness, which, they've seen. So you're going to have some soreness on the side. Same thing with the tetanus shot. If you remember your last tetanus shot, your arm doesn't get sore. And what I tell people to do to actually get it, make sure you move your arms so the muscles kind of do their work, and that usually make it a little bit better. I know one person online,
Yes.
was saying, would you have somebody operate on you not wearing a mask? I mean, I think she's just saying in general, because in the operating room, in general, you wear a mask so that nothing gets spread. You want the ear to be totally sanitary. Your scrub, your gloves. As a matter of fact, if any of you have been in the operating room, if say you accidentally touch your nose, you gotta have to go back and scrub again. you know.
Mm.
So if your nose itching, you have to find somebody in the room who is not scrubbed in to scratch your nose for you, kind of thing. So really, when you think about it, it's the same thing with the vaccine. It's providing a barrier to kind of decrease the spread. So it's something that we should be all aware of. Someone also asked, what did some say? Where do you think we will go to get the COVID? We don't know yet. We'll see what they do. Most likely is going to be like at a hospital or a facility like that. I mean, some doctor's office, maybe the bigger, organizations may be able to do that. And actually, if it's the Pfizer vaccine, it's most likely going to be in a year like that, because even though, just so you know, even though they say it has to be frozen at that very cold temperature, once
Right.
they defrost it and they mix the liquid with it, I think it lasts as long as 6 hours. So it's not like, so potentially I could pick some up someplace, bring it, and then be able to give it. So we have to see how all that logistic goes. The people that are working in the hospital, though, most likely they're going to get it, in the hospital is what I'm going to think. They may have, teams that go out to a nursing home, for example, to get them done. And they're probably going to, the other thing they may do, they may set up sites, whether it's out of a hospital, it may actually be something they're good. They may set up one of the stadiums, with all the things set up, and they can do a mass amount of people. You can just drive up in your car. You don't probably even have to come out. They just check your temperature and put your arm out, and they give you your documentation. So I think we have to wait and see. And that's one other thing. A lot of those logistics have not been worked out as yet. Because remember, that first wave that's going to come out is probably going to be more the hospitals for the
Right.
frontline, and not even just the regular hospital work. Because right now I'm not actually I don't go to the hospital. I do most of my office. I'm actually not even that first batch, even though I'm a
Right.
physician. I won't be. But it's those people who are got to be in the ICUs, got to be in the hospital on a day-to-day basis. Okay, and then they'll go to the firemen, the policemen, and all of that. Mm-hmm.
So with this contact tracing, do you think then, because this is phase 3 and you still somewhat are in the trials, one of the things they want to do once you are inoculated, they really want to track you?
Yes.
Or are they going to create a sample set and then study that set, or they're going to use the entire population? How does that
I
work?
think once you get the vaccine, they're gonna know exactly who got the vaccine. And I know a lot of people are worried about privacy and that. Listen, where this is concerned, I think they need to know, because they're gonna probably track everybody who has received the vaccine in some way, shape, or form, which makes sense, because we need to know, you've got it. Also we need to make sure you come back for your second shot, because if you get it and then you play around or come back, you have to start over if a certain amount of time passes, and that'd be a waste. So
Right.
so we need to really make sure all of that is being followed, tracked, everybody getting their 2 shots, And then at some point, we will have whatever follow-up. Maybe some of that follow-up may be done by your primary doctor in terms of sending you for the antibodies after a certain time, but all of that would be, and I think they're probably, even now with shots, as we know now, your doctor keep a record of what shot you got, what date, the lot number, the
Yep.
expiration date. So all of
Right.
that is known, I once you've gotten a shot. So, and we probably be giving people a documentation, what they got, when, where, all of that stuff. And so you'll probably go back to our immunization card, or maybe we'll come up with an app or something, that all that going to be tracked. Yeah.
So what about those who have constantly taken the COVID test and test negative?
Mhm.
Do they really need to get the vaccine?
No, if they're negative, yes, because if they remember that once you have not had once you've not been positive, you should have. I mean, there's a few people, however, who probably had was exposed to the COVID, and they may not known and probably have antibodies. So I think if you're uncertain and you've been testing because you're in an high risk area, I think that person should probably get an antibody test done. All right, just to see where you are, and actually most all the people who have they've been positive, now they're better, I do send them for the antibody test because I think it's something worthwhile to know. Mhm.
So you can be tested negative for the COVID and positive for the antibodies. Is that
Yes,
correct?
possible. Yeah, because say you had the COVID 2 weeks, you were exposed 2 weeks ago, you're positive, nobody knew because you had no symptoms. You then got tested like 2-3 weeks later because, hey, I want to test. That test may be negative. And then, but then you probably potentially could have been exposed. But the thing is, if you have, mild, some antibodies, and there's no detrimental thing, by the way, to have antibodies and then get the vaccine, because your body's just going to fight it off and it'll be fine. The only thing is a waste of money, actually, and it's a waste of finances and a waste of giving somebody who don't need it while we have a bunch of people waiting in line.
Maybe you just want to boost your immune system to another level.
Yeah. Well, I mean, if it's waning off, yes, then that was it. But I mean, so I'm saying it's not a problem. So don't think I may have had it, don't know, and got it. No, if you've been always negative, just get a vaccine. You're right. I think that will be the way to go where that's concerned. And I know people, and I'm going to talk a little bit more. I know, but a few people, because there's a lot of fake news out there. Like, for example, one person, I don't know if you got it. I get so many of them. And actually, especially from my church brothers and sisters, I'm actually kind of speaking out a little bit on that today, that I really think our brothers and sisters need to be knowledgeable before you put things up on Facebook. You need to vet what it is. I'm not saying you can't have questions. I have questions like everybody else. But, you know how many people send me this thing about fetal cells, right? I don't know if you have seen that. You've gotten into that. That's a big thing. They're using aborted fetus to make the vaccines.
Ooh.
All right. So I really wanted to talk about that one a little bit today. I did the study. I did the research. Now, in the early years ago, development of some of these RNA viruses, yes, they did use fetal cells. And trust me, if you have some fetal cells just standing by, why not use them? And that's my prerogative. However, it is clear that both the Moderna and the Pfizer vaccine has not used any fetal cells in their development. They actually wanted
Bishop,
to be, they didn't want any country. What was that?
Explains fetal cells. Explain
Okay,
what
well, say you have you know what a fetus is, basically a sperm and an egg comes together and that forms a fetus. Now, if someone has had an abortion or somebody may have just had a miscarriage, all right, still fetal cells, they have used some of those fetuses in research, all right? And, because of course it's an animal protein that it can do stuff, because of course the same way we use mice, same way we use chicken embryo, right? That's a chicken fetus, if you want to make it. So a lot of these, because you need a medium to grow cells. So they have used some of this. So in some of the early research, they definitely have used stuff because stuff that's available is what they're going to use. However, both Pfizer and Moderna didn't want to have any controversy. in any of this stuff because then you knew it was going to come. And of course, this is one of the things people are spreading, that the
Yeah.
vaccines are made using aborted fetus. We're promoting abortion to get fetal cells to do this. That's not so. So I want to quell that one myth right now because, and I specifically, and if you go to any of their sites and go and look up the details, they specifically did not, do any research that involved fetal cells. All right, so COVID-19 vaccine and fetal cells. Some of the COVID-19 vaccines started in clinical trials use cells originally selected from fetal tissue. And these are some original studies in their thing. But historically, fetal cells lines were derived in about the 1960s and 70s from two elective abortions that were not performed for the purpose of vaccine development. But they used the fetal cell lines. So from that, they got some fetal cell lines, which of course you can clone and grow cells. And they
Right.
use some of those in their development of vaccines for hepatitis A, rubella, and rabies. So the fetal cell lines being used to produce some of this. I did use some of that in the past. And I can give you specifics on that. But are the Pfizer and Moderna vaccine developed from fetal cells? The mRNA COVID-19 vaccine produced by Pfizer and Moderna do not require the use of any fetal cell cultures in order to manufacture or produce a vaccine. So that's fact. And I just wanted to give that out because I know, I have one particular brother that I may actually nix him as a brother, but that he keeps bombarding me with all of these news and, he's one of those who thinks you shouldn't wear a mask. He's an anti-vaxxer and all of that stuff, which I'm okay because it takes all types for the world to go around. But
Absolutely.
but I was really taken aback because the one thing the Lord doesn't do, even if you're crazy and stupid and dumb, when you come to the Lord is going to turn that around. And he gives you a mind and he gives you a brain and he gives you intellect. So,
Yeah.
and I think people should stop, and I really want to say that people should stop just spreading fake news. When they
Yeah.
send me these things, I say fake news and send it back, but they just keep sending them. So people that are Christians, if you're giving out false information, you're not doing right. So I really want everybody to look at the information, and trust me, I don't mind investigating it. And even if you send me something privately and said, what do you think about that? Because now my more upright brothers, that's what they do. They send me something and said, hey, I read this, what do you think about it? But the others who are just plastering it over Facebook and, jumping on these bandwagons, they got to cut it out. And they have to start acting like the people of God. So I'm sorry,
Well,
I cry, I had to kind of get that out. So go ahead.
that's all right. Well, I just want to add so folks know that there are seven
Mm-hmm.
vaccine in phase 3 clinical trials. And you mentioned the Pfizer COVID-19, the Novax, they
Mm-hmm.
got the Moderna, they got the
Mm-hmm.
Janssen, and the AstraZeneca. So these
Mm-hmm.
are the seven vaccines out there. Each of them have to go through FDC for the approval. And I
Yes.
know there is one that's 95%, one is 96%. It looks like they're competing for the market
Yeah.
space,
Yeah.
But
Well, yeah, they're definitely competing because remember, this is still a capitalist country. So of
yeah,
course you're not going to do anything without thinking to get your capital back. All right. Yeah.
right.
But the good news, I think, is, and just so everybody also know, the Pfizer did actually what they did. They didn't take any money from the government to develop. They have gotten the orders. They have got about a $19 billion order from the government because the government said, yes, we'll buy whatever you have. However, like Moderna and some of the others actually took the money into development. So it's government money is paying some of that development and some of that research. But I think either way, I think whatever is coming out is going to be rigorously reviewed. And
Yeah.
that's why, even though people are saying, why is Britain ahead of us? I'm okay with that. Make sure they're looking at it and they're looking at everything and make sure it's appropriate, for use. I mean, there's vaccines that are out. I mean, and there's all kinds. There's actually various forms, and we'll talk a little bit more. I'll give you a little bit more statistics next week. But we
Yeah.
will, kind of kind of get you guys, pretty much up to date. But I really want you all that this is the purpose of Turning Point. Feel free to ask anything.
Absolutely.
Feel free to question anything that we say. All right. If you hear any medical advice, check with your own doctor. If you hear any religious advice, check with your own pastor. And this is what. But we're going to talk freely. We'll engage you in whatever you'd like to talk about. And as I said, we're going to follow up this next week with more on the same, a little bit more statistics. I didn't want to bore you today, but it sounds like people want to hear it. So we'll, oblige and go into that. But, we thank all of those for listening today and for watching. Make sure you share with your friends. We also going to replay this
Yes.
or next week, whichever one we think is the best. We're going to replay that over the Christmas week because we're going to take a break. So you can listen back for that. And of course, it will probably be right in the thick of things because by then the vaccine will be out. So people can then, have whatever question. And then feel free to, go to our website or either our church or Gospel Tabernacle and, send in your questions. We're more than happy to answer and to share with you. I mean, and when we're out of COVID, we're more than happy to then get together and probably have a Turning Point seminar where we do an in-person and still broadcast it, but where people can ask live questions and, do stuff like that. So more workshop type. Yes. So I'm going to shut up and ask Pastor to say some last words.
Right. Well, thank you very much, Dr. Ling. I think this was very informative, judging by the feedback we're getting. My personal take, I have never been vaccinated for the flu, and I've never caught the flu, thanks be to God. But I am not against it. Each one has their own immune system, and you got to know what works for your body. Now, with this COVID-19, as the vaccine matures and as more people take this vaccine and we learn more about it, I think I'll be open to it, given line of work. Being a pastor, we are on the front lines with our members. We want to make sure that our members feel comfortable knowing that their pastor is not asymptomatic or someone who could be potentially causing a spread within its congregation. So I thank you for joining our Turning Point. Again, if you'd like us to speak on any topic that you want us to speak on, send us a note, get on Facebook, email us, and we will entertain that. So thank you, and tune in next week where we get more into statistics, and hope you will still stay engaged. Thank you for joining us.
Blessings, blessings, blessings. Everybody have a wonderful rest of the weekend. God bless you. Stay safe, everybody. Blessings.
Turning Point family, what an awesome time we just had. To all our first-time guests, we truly appreciate you for joining our live broadcast. We would like to hear from you, so please send us your comments, questions, or testimonies of how this program has impacted your life. Our email address is info@pflmi.org. Finally, if you feel led at any time to give to this ministry, please visit us at pflmi.org and click on the tab for donations. You can also give via Cash App at $PFLMIORG. We're looking forward to meeting with you live on next week's program. Have a blessed and prosperous weekend.